ETHOS Explorers, welcome to one of OSMC's many locations across Michiana, where they specialize in orthopedics and sports medicine. Let's go investigate. Hi, today I'm joined here by Dr. Schramm, who is an orthopedic surgeon here at OSMC. Thank you so much for taking the time to share with us today.
You're welcome.
I'm first going to ask you, what exactly is an orthopedic surgeon?
So orthopedic surgeon is someone who fixes the bones and realigns them, but we also do stuff like muscles and tendons and nerves.
That's really awesome. Are there any other jobs within orthopedics?
So within orthopedics, people do special things. So some people just do the hand, some people just do the shoulder, some do just the hip.
When you were a kid, did you always know that you wanted to go into medicine, or did you have a different plan in mind?
I did not. I wanted to run in the Olympics. That was my plan.
Wow, so what was the switch from running to pursuing a career in medicine?
Realizing I wasn't very fast.
So what exactly did make you want to be a doctor, and what exactly does that look like with school and learning, and what's the process?
So I realized I wanted to help people, and I realized that I could help people very effectively by being a doctor. And so you need to go to college. That's, of course, high school, but college is 4 years. And then there is med school, which is another 4, so we're at 8. And then I did orthopedic fellowship residency, which was 5, and then another one in hand and shoulder. So there's another 6 years.
That's amazing.
Yes.
Is there any reason why orthopedics was interesting to you in particular?
So I like fixing things, and orthopedics lets me fix things.
Yeah, that's awesome. So in our lab, we are doing a make your own hand, which is a cardboard piece, and we use straws and strings to kind of make our own model hand. And we also have some hands in front of us. Could you tell us what kind of makes up the human hand?
Sure. So I'm going to pick up one of these hands here. This is the wrist bone, so coming down from your shoulder. There is the middle part of your wrist, which is called the carpus. Fancy word, just the middle part, or we call it the hand. And then the rest of these are the finger bones.
How would you fix a broken bone?
So depending on where it is, but when we have a broken bone, we have to open up the skin after someone's asleep, of course. And then I need to put something inside of it to help it be stable. So sometimes I put a screw, sometimes plates.
And what would the healing process after that surgery be like?
So unfortunately, you got to have a splint for about a month. And then you got to start moving your fingers so they don't get stiff. So about 6 weeks.
What are some sort of tools that you may use while you're in surgery?
I get to use fun tools. So I get to use drills and saws and screwdrivers. Stuff like that. That's
awesome. Is there a certain case or injury that strikes you as the most interesting that you've seen?
So one of the most interesting I have seen was today. We actually took someone who had a really bad elbow, and we gave them a brand new elbow.
Wow, so a full-on replacement?
Yes.
Do you have any tips that we could hear to maybe keep our bones strong and healthy?
Yes. I really think it's important to do calcium. Whether you do that with milk or with supplements, very important, especially for ladies. And exercise is very important to keep the bones and the joints strong.
Awesome. I know this job is probably super rewarding, but I'm sure there's some difficult aspects. Would you mind sharing some difficult parts of the job?
So for me, the most difficult part is when someone doesn't get healed right away. So I fix their bones, and it takes them a while to get back to playing baseball or volleyball, and it's frustrating for me to see them not be able to play.
Yes, I'm sure. Well, what are on the flip side, what are some things that you enjoy about your job?
So fixing people, letting them immediately do something better. Actually, a guy fixed his metacarpal, which is this bone right here. We fixed it on Tuesday, and he scored 25 points on Saturday.
Oh, that's amazing.
So that was fun.
Are there any other pieces of advice that you'd like to give to our young explorers watching?
Yes, I think it is worth doing. It's a long process, but the rewards are excellent, and you can really help people.
Awesome. Dr. Schramm, thank you so much for your time today and telling us a little bit about what it means to be an orthopedic surgeon.
You're welcome.
Check out the links below to see our other videos that explore more at OSMC.